Greetings and salutations, young true believers. So, the first topic in our applied ethics module, which is module 4, uh, concerns the euthanasia debate. Euthanasia from the Greek root words meaning good death. And so, euthanasia, very topical. As you may be aware, this physician assisted suicide has been legal in our neighbor to the north, not Canada, but Oregon, for quite some time now. And I believe, yes, it's legal in California now as well. Um, there aren't many places in the world where euthanasia is legal, though. It's legal in the Netherlands, Holland, um, a few other nations, not many. Um, it's a very controversial practice, although, well, we'll flesh out for ourselves whether or not we think it should be controversial, or whether or not the controversy is warranted. Um, so, obviously, most people, if they had a pet who was terminally ill and was suffering, we generally wouldn't think twice about ending their life prematurely, having a vet give them an injection that would put them to sleep, as we euphemistically say. But when it comes to human beings, this issue is a bit more fraught and a bit more, I want to say, a bit more difficult to suss out. So let's get clear first on the various stances on this issue, right? One stance on this issue that we're not going to consider at all because it's clearly not morally justified is what's known as involuntary euthanasia. Involuntary euthanasia is what, for example, the Nazis would do to mentally handicapped people uh, in during the Nazi regime. They would just, if you were if you had Down syndrome or something similar, some other mental affliction, birth defect, they would just euthanize you. Um, so that's clearly immoral. So what we're concerned about are two camps. There's active voluntary euthanasia and passive voluntary euthanasia. Let's talk about passive voluntary euthanasia first. Passive voluntary euthanasia is when you refuse medical treatment. So, for example, if you have terminal cancer, you refuse chemotherapy, or if you are on, say, life support, you direct you, or more likely your uh, power of attorney, whoever has power of attorney over you at that time, your spouse or your children or whatever, they direct the doctor to remove you from life support. Um, so this should be noted, a very controversial philosophical distinction: killing versus letting die. So it's argued when we remove you from life support, we're not killing you, we're letting you die. Your body is going to kill you, right? Um, Passive voluntary euthanasia, as I've just described it, is accepted by the American Medical Association. They consider that ethical and within the rights of a patient. Now, active voluntary euthanasia, by contrast, involves seeking out a physician who will help you administer a lethal drug um, to prematurely end your life. Now, no one has ever been euthanized, and no one advocates, so far as I know, euthanasia for mental disorders such as depression or uh, anorexia, bulimia, something like that. Uh, Euthanasia is reserved strictly for someone who is facing the torment of a wasting or terminal illness, something like Parkinson's or cancer, right? Terminal cancer. Um, and again, this is done in consultation with a doctor, right? Active voluntary euthanasia is not condoned by the American Medical Association. They vociferously uh, forbid it, right? And this would seem to be in the fall under the with respect to the killing versus letting die dichotomy. This would involve killing. We're not removing life support from you and your organs fail and we let you die. This is actively bringing into your life, right? So, in opposition to uh, euthanasia, active voluntary euthanasia, that is, there are two main arguments. One is what's known as the sanctity of life argument. The sanctity of life argument is the argument that the Catholic Church appeals to. This argument runs thusly. All life is a gift from God. Only God should decide when life ends. Active voluntary euthanasia involves human beings trying to decide when a human life ought to end, ergo, it's immoral. This argument is very commonly appealed to by opponents, not just of euthanasia, but also of abortion and capital punishment. Again, things that practices that the Catholic Church is historically frowned upon. Another common argument against euthanasia might be called the slippery slope argument. A slippery slope argument runs thusly. If we legalize active voluntary euthanasia, then it will only be a matter of time before doctors and even perhaps nurses are making life and death choices for patients instead of in consultation with them. And eventually we'll get to a situation where we have involuntary euthanasia. So those are two main arguments against active voluntary euthanasia. So what are the arguments for active voluntary euthanasia? Well, the most common one is the death with dignity argument, which runs thusly. My entire life, I've made choices which have directed my life, which have steered my life in a certain direction. I've called the shots, as it were. My life is the aggregate, the sum total of all the various decisions that I've made in my life. And so when it is time for me to die, similarly, I should be the one who decides the manner of my death, not a doctor, not a lawyer, not a nurse, but me. And so if I'm faced with the prospect of agonizing decline as a result of a terminal illness, then I should have the dignity and people should trust my judgment enough to respect my decision to end my life prematurely. Now, James Rachels, who's written a famous ethics textbook that I like to use when I teach ethics, he has this famous example that he uses against opponents of euthanasia. And he asks you to imagine two scenarios. In both scenarios, someone stands to gain from the death of a young person. They stand to gain a large sum of insurance money. So in the first situation, the evil parent sees their child in a tub. They walk in and they actively drown the child in a tub while the child's bathing, right? In that situation, they clearly intended to kill. That's the killing part. In the second scenario, the would-be murderer watches as the child slips, hits his head, and falls into the tub and drowns. They don't do anything to save the child from drowning. In this case, they didn't kill, they let die. So Rachel's asks, when all is said and done, what's the end difference, right? Is there a difference to be had? No, there really isn't a distinction between killing versus letting die, right? Ergo, the opponent of euthanasia should not say that, well, with passive voluntary euthanasia is fine because we're letting die. Again, when all is said and done, the result is the same. Now, this is an important consideration. This is an objective question, right? Does legal, active, voluntary euthanasia result in a slippery slope? That is to say, if we allow this practice to happen, is it the case that increasingly patient autonomy is withered away and doctors and nurses are making choices on behalf of patients instead of in consultation with them? Well, what the evidence shows is that this is generally not the case. Now, most of this evidence is from one nation, the Netherlands. And again, because euthanasia has been legal there for about 30 or 40 years now. The evidence shows that less than 1/10 of 1%, or excuse me, 1%, less than 1% of the total cases of active voluntary euthanasia in the Netherlands have been performed without direct patient consultation. And in the vast majority of those cases, consent was given before the patient slipped into a coma. So there's no evidence that currently that active voluntary euthanasia leads to involuntary euthanasia. That having been said, we have a very small sample size that we're working with. More evidence is needed, so people will research into this question will doubtless be looking at the uh, examples from Oregon and indeed our own state to try to ascertain whether or not uh, there could be potentially a problem. But thus far, the evidence doesn't suggest that.